My name is Dr. David Chiro. I'm the spine guy. I'm with Complete Spine Solutions, and thanks for checking out my vlog. I wanted to share with you and kind of explain what the research that was done related to COPD, that's chronic obstructive pulmonary disease, the research that was done for patients with that condition and how spinal manipulative therapy, also known as an adjustment, help people with that condition. And we're going to apply it. I'm going to explain how it works, why it works real quick, and then I'm going to explain how what we do in our office actually helps people achieve even better outcomes than the outcomes that were in the study. All right, so here's how it works. What they did was they took people who had this condition. In other words, these are people who, and this is, by the way, the 6th leading cause of death globally. So it's a massive problem worldwide. When you can't breathe, I mean, all you want to do is to be able to take a normal breath. The problem is a lot of people get lulled into that situation. So this is a degenerative type of condition. It happens over time. So people don't even realize it's happening until, like, they just can't breathe normally. And it's a terrible situation, but the problem is so many people don't know as it's happening. They don't find out till they've got the condition. And even then, as is shown in the studies, in the study that was published, was that we can help people who have that condition even when they have it, even when it's in an advanced stage. You can actually breathe better. So I want to share with you how that happens and why that happens in really simple terms so that you understand it and just kind of break it down and distill it down so maybe you can help somebody who you know who has this condition. All right, so when you can't breathe, it has a tremendous effect on the oxygenation of your blood. In other words, your body can't really perform the way it's supposed to. Your body has to work that much harder just to get blood, oxygenated blood to your body. So you're really having to breathe more shallow breaths more rapidly. That puts more wear and tear on your entire body and really shuts down your overall health. So let's talk about how the study impacted these people with this terrible condition. And by the way, the same premise, we can extrapolate this condition of COPD with people who have asthma and people who have other breathing difficulties. I'm going to even apply it to athletes in a minute to help those of you who are athletes and weekend warriors or really even professional athletes perform better, get better lung volume, and be at your best. All right, so let's go over quick anatomy right here. I've got a model spine. Now, this is what the spine looks like from the side. Okay, you have, this is the front, this is the back, there's the back of the skull, and down here's the pelvis. So the lower back curve is supposed to be this way here. That's called a lordotic curve. The thoracic curve, or the upper back, are supposed to have this type of curve. That's called a kyphosis. And in the cervical spine or the neck, that's also supposed to have a lordosis similar to, but not the same as the lower back. Okay. Let's focus on the upper back because that's really how the COPD patients, this is going to impact COPD patients the most. In this area, what they did was they adjusted or they mobilized the joints of the spine. Now, by mobilizing the joints of the spine, when joints are stuck out of position, they don't move very well. Joints that are out of alignment, they can't really move. They don't have the same motion as joints that are in alignment. That's pretty logical, right? So what they did was they mobilized the joints in the spine, and when you have more motion in this area, between the vertebra of this area, this chest cavity can expand and contract because it can move. When this upper back area doesn't move and is rigid, it's difficult to take a normal breath. You really can't. And you can even I can even demonstrate that, or you could do this at home, and that's just by increasing the curve of your upper back and trying to take a deep breath. Why don't you do that for a second just to understand how these people's lives are. It's a horrible situation. So increase the upper back curve and then try to take a deep breath in, and don't move your upper back while you're doing it. Holy cow, you can't breathe normally. Imagine living a life like that. It's a terrible situation. So by mobilizing these joints, these nerves in the mobilizing the joints, it creates more motion in the upper back and allows the chest cavity to expand and contract as a person breathes. So you have more motion. It's really logical that it's going to be easier for you to breathe. This is not a cure for COPD. It's not a cure for asthma. However, it does have a mechanical impact on the way the lungs function. Pretty cool, right? Now, another condition that many of these people have, and by the way, men, when they hit 60 years of age, the upper back curves, the normal upper back curve increases by 10 degrees. And you've seen older people, that it seems like as we age, it's actually chalked up to normal, by the way, difference between normal and average, but I'm not going to get into that here. But it seems normal, it's actually average. The average person does increase the upper back curve by 10 degrees when they hit 60. By the time they hit 60, it's a gradual process, right? So what does that do? When you increase the upper back curve, just like we demonstrated, it shuts down. The lungs are sitting right here. That you don't get that normal rise and fall of the chest. These bones, these vertebrae literally start to sometimes fuse together, or the ligaments between these vertebrae are fusing and becoming hardened, so you can't get that same normal breath. So it's almost like being trapped. You know, you're trapped in this body that's the skeletal system that's hardening as we age, degenerated, breaking down, increasing in curve, which is putting compression, massive compressive forces on the lungs. So forget about COPD, forget about asthma, any other kind of breathing difficulty. Our lung capacity decreases with age, partly because of a mechanical problem that we have in our spine. Now, when you go to your doctor, your pulmonologist, they're not really looking at this structure, and they're not identifying it, and they don't even address it with these patients. Unfortunately, the patients are suffering and are never going to reach normal or maximum lung capacity, maximum lung volume, if your back is like this. So what we do in our office is we analyze the mechanical curves of the spine. Are they within a normal range? And are they impacting our breath? So if we have an increasing upper back curve as we age, that could be potentially the problem with these people breathing. It could be compounding their problem, complicating the issue for these patients. So what do? In a case like that, we analyze it, measure it, see how bad it is, and if it's more than 10% off of what it really should be, or of what normal or ideal is, then we want to test it. Can we improve the structure? Is it fixable? There's no sense in trying to fix something if it's not going to move. But most people's spines, not everybody, most people's spines can move. The problem is they're not applying the correct mechanical forces in the correct direction to make a permanent change. So that's what we do. We test it. So we want to see if the spine can come back to a more normal position. By testing, we do some flexibility testing of the upper back. It's really cool stuff. It's proven, it's reliable. We can determine whether or not we can move somebody's spine, what the outcome will be before we even begin that process. So we know what the end game is. What are we trying to achieve? How cool is that? Literally, just by changing a person's structure, going from this to this, even if they have COPD, even if they've got asthma, even if they are not breathing normally the way they want to or should, we can increase someone's lung volume. Now imagine being able to do this on an athlete who has an increased upper back curve. We're talking about the difference between an Olympian and someone who isn't going to make the Olympic trials. We've got the Olympics coming up. So really, this is a huge aspect, and it has a huge impact on a person's life. So as we age, the upper back typically increases. That decreases body function. So we're having a profound impact using chiropractic biophysics, which is this analysis and treatment that I just mentioned, where we're able to realign someone's spine in a more normal, younger, healthier position, and that has a profound impact on how people feel, function, and age. So how cool. Like literally you can age in a better way. You can take your state that's been on a downward trajectory, losing lung capacity, worsening in posture as we age, and literally change that structure around and right it and turn back the hands of time, make you feel and function like you did 10, 20, and 30 years ago. So we're doing this with patients with COPD in our office all the time, asthma, and even taking athletes who just want to perform better, just want to make the team or be more competitive, or even a weekend warrior who just wants to get more out of their workouts at the gym. Structure affects neurology, which affects organ function. Also, structure affects the physiology. Literally, compressive forces mechanically can compress lungs and other organs in the chest cavity, which shut down organ function. So by taking that stress off, by opening up the lungs, allowing your body to feel and function amazing again, the way you did 10, 20, and 30 years ago, we're taking people who are functioning at this low level and lifting them up like they did when they were young. You don't need to be an older person to be evaluated for this condition or this structural problem, this mechanical problem. My recommendation is actually you get checked when you're young. This doesn't happen when you're 60. This happens progressively over the course of your lifetime. So the best time to intervene is before it becomes a crisis, number one, before you get diagnosed with a condition of COPD, or before your joints or ligaments harden. It's so much easier to change literally in children, but even if you're not a kid, it's okay. We can still, in most cases, help turn people's lives around by assessing their mechanics and altering their structure and literally changing their lives and going from this state to this state. Thanks for watching, and share this video with someone who you care about who isn't functioning to their peak potential.